Hello guys, if you're seeing me for the first time, this is Sophia Adeze, and on this show I'll talk about health, well-being, and talk about politics of great concern, and also address motivational talk and weekly declaration. Today we'll be talking about the kidney. We'll be looking at the kidney, one of the vital organs of the body. Other organs are very important, but the kidney is one of the most vital organs of the body. And this kidney have been greatly abused in so many ways, either through the use of drugs, food, and other form of things. So today we'll be looking at the situation of the kidney. The kidney is like a bean shape. It's like beans, but a bean shape, and there are two in number situated in left and right flank of the body, lower part of the body here. So when it comes to anything clean up, working hard is the kidney. Filtering waste out of the body is the kidney. Removing excess water is the kidney. Controlling blood pressure is the kidney. Controlling potassium in the body, even up to keep your bone and blood healthy, is the kidney. Then imagine out of all these things that I've just mentioned and the kidney just stop working. What happens to all these numerous things that I've just mentioned and eventually the kidney stop working? What's going to happen? The entire organ of the entire body will just shut down because all these things that the kidney have been removing will build up. There will be no exit way. Everything will pile up. It will look like a soak away, that a drainage that has just blocked. Apart from being blocked, it will be smelly. So imagine when all these things are not working in the body and the body get blocked, the human himself will become very uncomfortable because all the waste have been retained in the body. That's what's going to happen. The whole waste which this kidney have been helping to evacuate will remain in the body. Now, what happens next? It's a question. That is what we call kidney disease. When the kidney cannot carry out the function that it's supposed to carry out, especially to the amount, becomes kidney disease. Good. And yeah, and there are different causes of kidney diseases. One of the causes of kidney disease is diabetes. When your blood sugar continuously go high and you don't control it, you don't see your doctor. Some people don't even know that they are diabetic. They come to hospital for a different reason, and when you do their blood sugar test, you see that they are diabetic, and you ask them, are you diabetic? They say no, but it's extremely high. A lot have been discovered for other cases. So that is one of the causes of kidney failure. Another one again is high blood pressure. Yeah, when your blood pressure is extremely on the high side, it goes very high. When you look into the kidney, you see we have two arteries entering the kidney, vena artery. We also have the renal vein, the one that takes the blood out of the kidney. So when blood goes into the kidney and leave the kidney, there's something happening. There's something that filters this blood. And when it filters this blood, it filters all the rubbish in the blood out, and they all go out as a urine. Yes. Now all these are happening within the kidney. We have the arterioles in the kidney, which helps to carry out this movement of filtrations too. Now, if there's diabetes in the blood of an individual, those arterioles that carries out those little functions of movement of blood and filtrations, it gets damaged. Those this kidney will not longer be able to carry out those filtration in the kidney, because there's something we call filtration. It happens in they call it glomerular filtration. It happens in the glomerulus. When these arteries die, that filtration cannot hold anymore. Then another thing that damages the kidney is high blood. When there's constant high blood pressure, the arteries too suffers. The blood pressure plays force on those tiny vessels. Over times, it weakens the vessels because of the pressure of the blood on it. And the same thing, it loses functionality. Another thing is the abuse of painkillers. Using painkillers unnecessarily or abusing it, especially ibuprofen, it has an effect on the kidney. It has a damaging effect on the kidney. So this medication, like another one is alabukun. All those salicylic acid medications, they're damaging the kidney. It poisons the kidney and they stop. Another thing is not drinking enough water, especially this time that we are getting into summer. The weather is getting hot. The body need water, and body has a way of compensating itself, which we call the homeostasis. When there's not enough water in the blood, the brain tells the body that there's not enough water. The kidney actually need much water to carry out its filtration. It's just like you grinding something in your grinder. You need water in that blender to be able to function properly and grind and filter or bring out your product. But when there's not enough water, what the brain does is that the brain will take the one that it has in the body to give to the kidney, and the kidney itself, he will not have enough to bring out as urine, because the kidney will not bring less urine because already there's not enough water in the blood. It will want to compensate the body because you don't want to draw out the whole water in the body and pull them out as urine, making the body to become highly dehydrated, which we call tissue dehydration. So the body may want to, in a way of compensation, which we call the homeostasis, he will now want to keep some water back. So what happens is that when there's not enough, the kidney actually need water to function. Under that one immediately, if you are dehydrated and you are not taking all this medication, it can also cause kidney stones. Kidney stones is another thing that causes blockage in the kidney. Kidney stones, they travel around all those tubular area and move around those spaces in the kidney and form blockage. And what happens when there's blockage? When there's blockage, it affects filtration too. It affects the glomerular filtration. So remember we said the blood entry into the kidney and the ones coming out. So if stone is there, you see the pile up of water that will not damage the kidney. Those water that's supposed to come out will not come out. Those stones will pile up the water in the kidney. And again, then something will call toxins. Toxins. If you start exposing yourself to something that will cause toxins from either atmospheric environment, from cream, from some food, some exposure to all these toxins, yes, that again can also affect the kidney. Yes, it affects the kidney in several ways. It affects it and cause damaging to the kidney. Yes. So if you have a family history of kidney failure or kidney damage, if kidney problem runs in your family, your risk is already high. Just as we say, some people have diabetes in their family, we advise them, mind how you take sweet things, sugary things, and other stuff. So when this runs in your family, you have to take extra precaution. So you have to look after your kidney. Yeah. So as the damage gets worse, when the kidney start to fail, you will not feel anything at the first time. You might not notice it. You won't even feel anything when the kidney start, damaging. So you will not feel anything. But as time goes on, you notice edema. Edema is the swelling of the lower limbs, the foot. You see the swelling there. Some people have puffy face, puffy hand, the extremities, everywhere getting swollen. The body can no longer send out the excess urine anymore. Everything starts piling up. Another thing you can also notice is that your urine, when you pass urine, it looks like there's soap inside. When you pass urine, you see a lot of foam. Yes, that shows that blood is starting to leak. Protein is starting to leak from your urine. So when you pass urine, it foams like soap ladder. Yes. So that's because there's large amount of protein passing through your kidney, which is not supposed to. So at this point, waste products have started building up. You even experience itching skin. You see them itching their skin because of those toxins. The toxins are now beginning to lie under the skin and they're itching. Yeah. Then another thing, the person become breathless. Every little thing, they experience shortness of breath over every little exercise. Yes. So occasionally, sometimes they feel like that they are drowning. So when you start feeling all these symptoms, get tested. It is better to find kidney problems early. Do not ignore, please. I know these days you call the GPs and sometimes they turn you down. It's a gospel truth. That is the truth. To get appointment is hard, but keep pushing. Yeah, don't give up. It's your health. So another thing that can help this situation is dialysis. Dialysis is simply a way to clean your blood when the kidney is no longer cleaning it. And there are two types of dialysis. We have the hemodialysis, like an artificial kidney. The work your kidney is supposed to do, the machine will do it. Remove the dirty one and return clean body. Every session lasts probably about 4 hours. And you need it about 3 times a week. Yeah. Some of them are very expensive. Like in Africa, it might be up to 70 to 150,000. Not everybody can afford it. We have peritoneal dialysis. That is another one. Under your stomach, there's something called the peritoneum. They, they insert something under the abdomen and pull out. So another one is a kidney transplant. What simply means is that a healthy kidney of a healthy person is taken and inserted into this person and remove the sick kidney. Okay, this this actually happen when the kidney have totally stopped. Okay, so it does not mean that even when somebody is given a new kidney that this kidney will totally work. There are tests we need to do to make sure that the kidney accept to make sure that the body sorry to make sure that the body accept the new kidney. There are situations where the body itself rejects the new kidney. Yes, it happens to some people. The body rejects the new kidney. So we have to also check for the body to accept it. Another thing you also need to understand is that, especially in Africa, dialysis is scarce. Over 200 million people, most of them are stuck in different hospitals waiting for dialysis. Mm? The specialists are few. We have less than 250 nephrologists in Africa. Most of them have left the country. Most of them are in the European countries. Not because treatment is bad, but because they cannot afford to continue. So, what can be done is best said prevention. First of all, check your blood pressure, check your blood sugar, check your blood pressure, and if you have diabetes or hypertension, please take care of yourself. Treat it like your life depends. In fact, your life depends on it. Take it serious. Don't miss your appointment. Don't say, oh, I have a shift, I'm going to work. Cancel that shift. Go and look after yourself. When you come back, you can as well. Drink enough water. Drink water. Your body needs water. Be careful about what you eat and what you drink and what you rub on your skin. Be careful what you rub on your skin, what you drink and what you eat. On a more national level, we need more dialysis center. We've been telling this to the government. We need more nurses and doctors in the healthcare system. Yes, we need this because, and again, we'll also be pleading to the government to support those who are on dialysis with their payments. At least pay 60% of the payment for them and let them offset 40% to make it life easy for them. So please, at the long run, I want all of us to look after ourselves. We mind what we eat, even some of all these local herbs we should mind how we drink most of these local herbs. Some of them can be so harsh on the kidney without us knowing it. So please, if you have learned something new from this, like this video, share. You might be saving a life. Press the like button, share, and at the same time subscribe. It costs nothing to subscribe to our channel. Subscribe, you might be saving a life. So that, again, if you have any special topic you want us to talk about, just DM us and we'll talk about this topic. Okay, thank you. Share, like, and you will be saving a life.